When I get to work, first thing I do in the morning is click on and listen live.
Lite Rock 99.3.
Hi, I'm Mindy from Mike and Mindy in the Morning, and I was lucky enough to get a chance to interview Dr. Imami, who is the founder and medical director of TEPAS Breast Center in Melbourne. Some of his background includes the fellow of the American College of Surgeons, member in the American Society of Breast Surgeons. Also, he's a former associate professor of surgeon at UF. He also founded TEPAS Breast Center 9 years ago, and not only does he handle the Merritt Island location, the Malabar location, he also takes care of the Melbourne location. Here's the interview. You're the founding medical director of Holmes Regional Trauma Center back in 1998.
Back in 98, I started the trauma program at Holmes Regional. It was the 19th trauma center in the state of Florida,
Wow.
badly needed, and still in existence today. So I founded that and directed it for several years.
You're a very busy man.
It's been fun.
It is.
It's been fun. Exciting.
And then the founder of TEPAS Breast Center, I think that is probably your baby, right? Is that the one that you really cherish?
It is. It is. I started TEPAS Healthcare back in 2004, and now TEPAS Breast Center is starting its 10th year.
Wow.
Can't believe
Really?
It's been that long.
Oh, my goodness. And that's why we want people to understand, especially women, about breast cancer, being October being Breast Cancer Awareness Month. The technology, I mean, you and I have been talking about it before we went to do this interview, how incredible the technology has come.
There's been huge technological advances. I think a lot of the advances have come along the lines of genetics and trying to understand, why people get breast cancer and can we identify them, and if they're at high risk, what can we do to lower their risk? So there's a whole other discussion about trying to find high risk women,
Right.
whether it's a genetic predisposition or whether it's environmental factors, and then screen them early and then offer them, say, like anti-estrogen treatments to try to lower their risk for breast cancer. So we don't have to just sit and wait around for someone that has a family history of breast cancer to develop it. We can actually intervene early and lower their risk. So that's on the preventative end.
Right.
And the screening still holds for women starting at age 40. I know there's been
Okay.
controversy about that, but we still stick with that and perhaps add an ultrasound if women have dense breasts. And women that are at high risk may even get breast MRIs. So those are becoming the norm for high-risk women.
And at TEPAS Breast Center, you have so many choices for women. What are some of the services that you offer?
Well, certainly mammography, ultrasound, breast biopsies. We also are the only place in the county that does 3D color mammography.
That's amazing, yeah.
And that's really a special tool for women that have breast cancer.
Right.
So it helps identify small little foci of breast cancer. And then we've put together a team of multidisciplinary physicians, medical oncologists. We work with them. We work with the radiation oncologists, the plastic surgeons, counselors. We've even spoken to people that do nipple tattooing. So try to do the whole thing, the comprehensive care for women that have any breast abnormality, and certainly those that have breast cancer.
Yeah, I think the fact that you tapped into before, during, after, because it's not just about the surgery. It's emotional state. It's the telling your husband or telling your family members, and you make it like a spa-like area where people can sit down and you do counseling from beginning to end. And I think that's fascinating.
Yeah, our office is a spa. So you come in and you're already tense before you come in
Getting
into
the
a
news,
doctor's office.
right.
So we have a calm, soothing environment. Let's at least take that away.
Right.
And then we'll help you through with the diagnosis and continue to support you through the whole journey. And then I'll see my patients, every year from that point forward. So we just don't cut you loose after the surgery. We want to make sure that we continue to follow you and provide you that support.
Yeah, and let's talk about the photo series, because I think that goes right into the photo series that you developed, which I think is, if people are going through it, at least they can hear someone else's story.
Well, it was interesting. It's been it's been years ago that I was actually up in New Smyrna Beach, and I happened to stop at a little post-mastectomy boutique. And I walked in and I saw a picture of a bald lady, a beautiful bald lady on the wall, black and white. And as it turned out, it was the owner of the post-mastectomy boutique. So we struck up a conversation. But it inspired me to start photographing my own patients. And over the years, I've accumulated hundreds of pictures and patients. And I capture the emotional essence of what they're going through. And then we've printed those out and given them back to a lot of the patients so that they can reflect on it. because it's hard for them to convey to, say, their husband
Right.
or their family members, what's going on emotionally. Hard for them to understand themselves what's going on emotionally. So when the dust settles, they can go back and reflect on some of these photographs about their anxiety in the operating room, or just before they're going to get radiation, or their celebration after the
Right.
surgery, and they
Yes.
feel good. So and we have another some pictures that are 2 years out where where they come in with their 6-month-old child. So
Right.
so it's very emotional, and we try to capture that and see if we can inspire other women and give them the support that they need through this
Absolutely.
vehicle.
And we were talking about radiation. One thing that you had an article in the newspaper about the 1-week radiation. What is that?
Well, women have the option of a mastectomy. So you can
Right.
remove the whole breast. But if you opt to keep your breast, then we just remove the lump, and then we need to radiate or sterilize the rest of the breast to minimize the chance of it coming back. And conventionally, it's been 6 weeks of radiation, 5 days a week for 6 weeks. But for many years, I've been promoting the balloon radiation. So we put a little balloon in there, and you get 5 days of radiation from the inside out, as opposed to 6 weeks from the outside in.
Okay.
So we collaborate with our radiation oncologists over at the Cancer Care Center to offer that to a select group of women. I mean, you have to have an early breast cancer to be eligible, but boy, you get the surgery, you get the radiation, in a couple of weeks you're done with the whole thing.
That's incredible.
Yeah,
That really is.
yeah.
And that's just on the tip of the iceberg on some of the things that you provide. What are some of the other techniques that's coming out now that you're all on top of?
Well, we work closely with our plastic surgery
Mm-hmm.
colleagues, and there's a move to spare the nipple. So
Mm-hmm.
people that are going to have, say, a double mastectomy, if we can preserve the nipple, we'll try to do that. Try to hide the scar as
Yeah.
much as we can.
Right.
And I know that women are excited that they're able to keep their breast, but to the extent that we can hide the scar, all the better. I mean,
Right.
it's not front and center when you're worried about the cancer, but then a year later, 2 years
Right.
later, you're wearing a low neck dress.
Exactly.
You're like, if it had just been hidden a little bit, it would have been all the nicer. So we work with our plastic surgery colleagues on trying to give them the best cosmetic result possible.
I just think it's fascinating that you guys are just tapping into every aspect when it comes to breast cancer.
It affects every aspect of your psyche.
Mm-hmm.
I mean, your hair falls out.
Yeah.
Your nails don't look good. I mean, we have a Medi Spa, so we can, you need your nails done, you need your eyelashes restored. I mean, that's all available at our location as well.
And the locations are Melbourne, Merritt Island, and Palm Bay.
And Palm Bay. Yes.
Great.
I mean,
And
our
then,
main location is in Melbourne
Right.
for the breast, but we can see you at the other locations as well.
and then there was something that we were talking about, the cryo ablation.
The Cryo Ablation.
Yeah.
Yeah. So what we did, we were the first in the county to do it, which is a cryo ablation assisted lumpectomy. So basically, we put the patient to sleep,
Mm-hmm.
put a probe in the breast using ultrasound, find the tumor, and then freeze it. And using ultrasound, freeze a margin of sort of tissue around the tumor, so we can see exactly. We want to dial in 5 millimeters, 6 millimeters, 7 millimeters. We can dial that in, freeze it accurately, and then basically remove the tumor. Sort of like the probe goes in, it freezes it at the end, so it comes out like a popsicle on,
Right.
on the end of a stick.
Right.
And so it minimizes the amount of breast tissue that we need to remove, and it's really a stepping stone towards not having to remove the tumor at all. So in a subset of women, typically those that are elderly and not a candidate for surgery,
Right.
so we could just freeze the tumor in the office. So that's what will be coming.
It's
on the
incredible.
horizon.
Technology. You just got to love it.
It's gone
It
from,
really is.
and we were talking about this earlier, Mindy, it's gone from 30 years ago where women were saying, Doc, why do you have to cut off my breast, and why do you have to take the
Right.
muscle and leave me so deformed, to where now we're doing less and less surgery. We're hiding the scars, eventually we'll just freeze the tumors away. And ironically, women are now saying, "Hey, doc, can't you
Cut
just
it
take
out.
them both off?"
Just
We're
take them,
"Listen,
right.
we're here to try to save them.
Right, exactly.
But that's some women do need that because they have a genetic predisposition. But those that don't, we really try to preserve their breasts as best we can.
And it's all at TEPAS Breast Center. I love it.
Is.
So
Thank you.
Maine is right here in Melbourne.
It is.
Merritt Island and Palm Bay.
Yes.
Okay. So, and then we're going to see you at the walk on October 22nd.
Absolutely.
Making strides against breast cancer at Space Coast Stadium. Dr. Imami, thank you so much for coming in again.
Mindy, my pleasure.
Yes. Thank you.
TEPAS Breast Center, the first comprehensive breast center in Brevard, provides cutting-edge medical technology and board-certified, fellowship-trained physicians. With 3D color mammography and same-day appointments, we have your breast care needs covered, with offices in Melbourne, Merritt Island, and Palm Bay. Protect your breast health with TEPAS Breast Center. Call today to reserve tomorrow's mammogram appointment.